Hey guys, so I completed my project on animal assisted therapy, and the definition of animal assisted therapy is the use of animals as a therapeutic modality to facilitate increased healing and rehabilitation of patients with acute or chronic conditions. And therapists use animals for their ability to provide patients with a sense of calmness, comfort, or safety, and also to divert attention away from whatever stressful situation they may be going through in their treatment. So, all animals may be used for AAT. Uh, all animals used for AAT are temperamentally tested to make sure that they would interact well with the patients. They receive full veterinary screening and complete obedience training. However, therapists do not require certification to do AAT. It is recommended that they receive some training, and there are some online certification or training courses that I saw, but it's not required to practice. And as you may guess, dogs are most commonly utilized in AAT due to their temperament, their mild temperament, and their obedience, ability to be trained, etc. So the role that AAT plays in occupational therapy, AAT is often used as a complementary intervention in OT to psychosocially prepare clients for engagement in other treatment activities. AAT may be used as a motivational factor as well during therapy sessions for individuals who place a high value on their relationships with animals, and maybe they've had, pets that have meant a lot to them, and this may be a motivational factor for them. It is seen as a method for building rapport as well with clients, increasing clients' self-esteem and reducing their stress and anxiety levels. Common conditions this is utilized for are treatment of patients with psychosocial conditions, such as depression, anxiety disorders, addiction, and schizophrenia. This is used as a method for improving the overall well-being and quality of life experience for patients with dementia. And it is also used with pediatric clients as a means of calming the children to promote increased participation in treatment, or if they have to get some sort of assessment or clinical testing done, the therapist may bring the dog in to just calm them down and just promote their participation, since they'll be more likely to be calm and participate. So evidence supporting AAT, I found Velde, Cipriani, and Fisher in 2005 completed a literature review of the opinions of AAT, which were held by patients and therapists who have a history of being involved with AAT. And the authors concluded that it is a potentially beneficial modality option for use in OT interventions when using the lifestyle performance model as a framework for interpreting outcomes. The Makova et al. Study in 2019 completed an experimental pilot study which analyzed the effectiveness of AAT for improving patients' general well-being following a stroke. And 15 patients were participated in this. 6 received the AAT treatment, which was supplemented to a typical occupational therapy program. And the experimental group receiving AAT indicated statistically significant improvements in mood, evidenced by the Likert scale when compared to the control group. And also a study by Wood et al. In 2017 looked at the use of AAT for institutionalized patients with dementia. And for dementia patients, they did a systematic mapping review of 10 articles, and it was concluded following review that canine assisted therapy provided opportunities and environmental supports which promote experiences of relative well-being, occupational engagement, and optimal functioning. So that's just a little summary of AAT, going over my handout, and that's about it. So thank you guys.